the vet monitor for the surgery, it's almost most of them are the same. The difference is in the mainly in the attachment. So
and age.
And
age.
Age.
Like there's other ones that have a lot of the same features, but you have to just look at the different buttons. Like when you turn it on, blood pressure, it will be heart, and you'll have a BP. Some of them may have like a pulse ox, like a PO2 button. There's some that will have a silence, like this one.
Yeah.
All of them have a few different. The buttons will look different, but your readout is going to look very similar.
Yeah. So can you point to the reading?
So this is going to be your heart rate right here, because it says heart rate.
Yeah.
Pulse ox, PO2. This is your blood pressure.
Systolic and diastolic?
Yes. Your CO2. This will actually show you your heart rate when you're hooked up to the, this will show you one of these will show you, I don't know exactly where it is, will show you your heart rate when you're hooked up to your leads. And it shows you a graph for the capno as well.
Okay. What about the CO2 and BO2?
This is like CO2 rates here,
yeah.
Internal, X, and then CO2 is right there as well. So you're going to see it here. You'll see it says CO2 right there.
Okay. And breathing, respiration rate?
I don't think it actually takes a rate.
I think this one.
Okay.
The respiration rate.
Okay.
Yeah. And what about the attachment?
There's different attachments, and not every.
So what we have in this one? Which is a basic, I believe.
No, it's so and it's all listed here. Here, the CO2, ECG, blood pressure, and then pulse ox.
Okay.
See, but there's also temperature monitors you can get.
Yeah.
Some may not have the ECG.
This one is for
pulse ox.
Pulse oximeter?
Yeah, because just think it has to. It's like when you go to the doctor and they put it on your finger.
Yeah.
This
and
one goes
you hook it in the tongue, right?
Tongue.
And it measures the oxygen and pulse.
Yeah, and it can also go on the ear.
And the ear, okay.
Or between the toes.
Okay.
The webbing between the toes.
Okay. And what about this one?
And remember to keep this wet.
All the time, yeah?
Yeah, I always have a syringe, and I put a little bit of water to keep, because if the tongue dries out, it doesn't see it as well.
Okay. What about this one?
This is the capnograph.
Yeah.
So this one has to be hooked up to your, basically your ET tube, your endotracheal tube.
Okay, so the endotracheal tube from this side and the gas.
Yeah, and it always only goes one way, remember? Because the ET tube is small, so it goes in. This one's small, it goes in. So
okay.
There's only one way you can do it. You can't screw it up.
What about the ECG?
The ECG is labeled. It will say right leg, right arm, so front, left leg, left arm, left leg. And see, you could essentially have more. We only have right and left front and left hind. And
it's enough. So not enough.
Yep.
Some machines will
have more.
Has more. Okay.
Yep.
Okay. And what about the blood pressure?
Blood pressure. Oops. You have to make sure you get the right size cuff for the animal.
Yeah. How we got the right size for the animal?
I just know.
Okay.
I know there's a calculation, but like this would be too small for the Frenchie.
Okay.
I would need a 3 for the Frenchie.
Okay, we're gonna use a 3 for him.
Yeah.
Okay.
But you always have
this side for the animal.
To the patient, to the artery
Yeah.
is here where the tube is.
Okay.
So you want to, and you have to remember you can't have the leg tied if you're putting it on, or you have to tie it lower. and you can't do it in the leg you have your vein in,
Okay.
or your IV in, because you're going to disrupt the blood pressure that way, right?
Yeah, it happened once with me.
So you have 3 legs to choose from.
Okay.
And it's better to go up a little bit higher, or if you have a big dog, you can go.
So do you prefer front leg or hind leg?
During a surgery, if I have to, I'd prefer a back leg, but you're in the way of the surgeon.
Yeah, so
because I can get a better reading on a back leg.
better reading. Okay.
I find that I can.
Yeah.
But because you're getting in the way, especially if it gets foobarred, I will typically go to the other front leg. But if you have to cross-hatch them, you know, you're adjusting the blood pressure by tying those legs. You know what I'm saying?
Yeah.
Yeah.
Yeah. Okay, that's great. Thank you, Renee. Bye.
Bye.